out of the house. We know that for some people it doesn't feel right to ask for help that you don't normally need. For many people, it's just hard to ask for help. The reason the Chief Medical Officer has asked you to stay home is to be confident that everybody over 70 and people with underlying conditions have the best chance of avoiding COVID-19. It's one less person to worry about contracting the disease. The best way to think about it is that we need your help, and staying at home is how you can help. For everyone else, we still need you to wash your hands regularly and thoroughly, use good cough and sneeze etiquette, observe social distancing measures, and remember that you're part of the front line. We heard the doctors telling us at the weekend that the next 7 days are critical. So far, so good, but we need to stick to the restrictions. Everyone has their part to play, and you have been playing your part, and that's why it has been effective so far. But we need to keep this going, to flatten the curve more than we have. Finally, keeping our physical distance doesn't mean that we shouldn't keep in touch. Remember to stay connected with friends, families, and neighbours at this time. If you need help, or you know someone who needs help, or a listening ear, please call the Alone helpline. It's at 0818 222 024, or call your local authority helpline where you can get help with practical daily needs. Business supports. The temporary wage subsidy scheme introduced by government is continuing to have a strong uptake. 39,000 employers are now registered with revenue for the scheme. Today, revenue has generated further refunds under the scheme worth €14 million. These payments will be in the bank accounts of the majority of the respective employers tomorrow, the 7th of April. The cumulative value of payments made under the scheme is almost €87 million. As you know, a business support call centre opened on the 13th of March. So far, 1,500 queries have been received by phone and email. The number of queries peaked on Monday the 30th of March with over 100 queries that day, but moderated to a daily average of around 55 over the remaining days. Calls received last week are broken down as follows: 33% relating to essential services, including retail and online trading, 26% relating to income supports, and 21% relating to business and financial supports. The business support call centre line is 01 631 2002. In terms of employees, the weekly €350 payment run of the Covid-19 pandemic unemployment payment issued from the Department of Employment Affairs and Social Protection over the weekend, and it will be available to customers from tomorrow, the 7th of April. Customers should check their bank account tomorrow or their post office if this is their method of payment. The helpline for any inquiries is 1890 800 024. And just to say a word about essential workers. We all know that everyone working in the health service, both public and private, have a critical role to play in the management of this disease. However, we also recognise the many, many other workers who are also vital in keeping food on our tables, medicines and medical equipment in pharmacies and shops. Those ensuring our critical infrastructure is safe: electricity, gas, water, waste, transport, information and communications technology, and repair and maintenance and other critical construction projects. Those working to keep our supply chains open, and those within those supply chains, from farmers and agricultural sector to ferry staff, hauliers, drivers and delivery people, essential retail workers, those working in manufacturing and distribution of essential goods. Those keeping our banks, credit unions and post offices open, the people behind the scenes keeping all those people paid, keeping workplaces clean, getting essential workers to work, and ensuring that social welfare and other payments are made to keep the country moving within the restrictions. And I thank you also to all of the workers who have been redeployed from their usual jobs to pitch in where essential services need their support. Community measures and supports. So the community call, so that's just a reminder to those who need help with practical supports like food, fuel or medicines delivered to your home. You can call your local authority helpline or email them, and these contact details are on govt.ie, or alternatively you can call alone, who can put your call through. I also want to tell you about how An Post is supporting and contributing to the community call. An Post is rolling out 2 new services to support communities during the current Covid-19 crisis. Request to Check-in is a facility for family members to request a specific An Post check-in by the local postman or postwoman for an older or vulnerable person during the current cocooning period. You can register for a free Request to Check-in service by completing the postal address and air code of the customer at anpost.com/community support. These details will be sent to the customer's local post person who will call to that address. If that person has any specific needs for groceries or a prescription, the post person will provide them with details of a loan, the national charity, and also launching today An Post is An Post's newspaper delivery service, which will provide a same-day delivery to households nationwide Monday to Friday. And we know a lot of people, particularly those who can't leave the house, like to get their newspapers. So you can find out more about ordering your chosen newspaper through anpost.com or by contacting your chosen national or local newspaper directly by phone. Once you've signed up and arranged for payment, An Post will provide a same-day delivery service for newspapers, and deliveries will be free of charge for older and vulnerable customers currently cocooning during Covid-19. Justice and direct provision. We are aware that there are some concerns around the impact of Covid-19 in direct provision centres. Intensive work has been underway in the Department of Justice since the emergence of the Covid-19 crisis to ensure, to the best of their ability, they protect the health and welfare of asylum seekers and refugees availing of their accommodation services. And they are guided by that by the HSE and the National Public Health Emergency Team. Since the crisis emerged, contingency planning has been underway across direct provision centres. Centres have been requested to generate on-site self-isolation capacity, and as a further protection for all residents, some centres have been temporarily closed to visitors. Last week we announced 650 new temporary hotel beds, which have been procured following intensive negotiations by the Department of Justice within a very short space of time. These new beds are being used in a number of ways, including to support the measures required for vulnerable residents, to provide off-site accommodation for self-isolation, and to help with social distancing measures by reducing the overall number in some existing centres. This increase in capacity is a critical part of the overall strategy to protect residents. Further off-site self-isolation facilities are being examined on a regional basis as well. In terms of access in the context of family law, we want to reiterate what Minister Flanagan has said over the weekend in relation to access arrangements in family law cases. We appreciate the concerns that the public health emergency is causing for many families in relation to court orders for matters such as access, maintenance and guardianship. However, court orders in relation to access remain in place. The restrictions brought in to tackle Covid-19 do not stop them being implemented. It has also been clarified that parents can come to mutually agreed arrangements for alternative contact, which could involve phone calls or Skype or other methods. It's important that parents communicate about agreements made for the Covid-19 by text or email. Mediation services are still available and they should be used if you're having trouble coming to an agreed arrangement. And of course, everyone should remember at all times that the welfare of the child is paramount. Details of services which provide help and support to parents are available on govt.ie. On the international side, over 70 Irish citizens departed India safely on the 4th of March on a flight organised by our embassy in New Delhi and Consulate General in Mumbai. As part of our shared global commitment to respond to the Covid-19 crisis, the flight also carried over 100 citizens from a number of EU member states, the UK and Brazil. To date, the Government has assisted 2,700 Irish citizens in returning home to Ireland since the outbreak of the Covid-19 pandemic. Currently, we are trying to help a further 2,000 of our citizens to return home. Many are in small groups, but the majority at the moment are in Australia, with a couple of hundred in New Zealand. Citizens should contact the nearest embassy or consulate to update them on their situation and they should closely follow information provided on the Embassy Twitter account. They are providing as much factual and practical information as possible. And then some concerns and issues. So in relation to nursing homes, last week the National Public Health Emergency Team recommended additional measures to further support nursing home residents and staff. These recommendations arise from the identification of clusters of Covid-19 cases within a number of nursing homes. The Health Service Executive will be working closely with the sector to support a range of additional measures to reduce the risk of transmission within nursing homes. Importantly, each nursing home will be identifying a Covid-19 lead. The HSE will provide access to personal protective equipment, expert advice and training. Staff movement across residential facilities will be minimised, and the HSE will support staff with alternative accommodation and transport if that's required. Staff screening will also start in nursing homes twice a day, and Covid-19 testing will be prioritised for staff. In addition to these measures, a temporary Covid-19 financial support scheme is being introduced by Government and will be established in the coming days to support the critical services provided by nursing homes. The scheme will provide temporary assistance payment to support private and voluntary nursing homes in managing any outbreak that occurs, and it will be reviewed after the first month's operation. Thank you.